So a little bit more to the pulmonary function test. So we see FEV1, which is 98%, looks good. The ratio is 81%. The TLC, total lung capacity of 5.27, 76%. This patient has some inspiratory, so this specifically is the diaphragm pressures that we're looking at, the maximum inspiratory pressure. It was done in the upright and supine position. So 142 centimeters of water and 116 centimeters of water. And then the maximum expiratory pressure, 154 and 168. So slightly decreased maximum expiratory pressure, just below normal for the expiratory pressure in the upright position. We have a static chest X-ray. Nothing whopping there. Otherwise, looks like a normal chest X-ray. So again, based off of the data, the chest X-ray, the PFT is, again, broadly diagnosing what does this patient have. Restriction, obstruction, both, neither. Is this just a normal patient? So show you the dynamic image for this patient. So we saw a nice tidal breathing, nice diaphragm excursion, simultaneous movement during tidal breathing. We see good, nice forced inspiratory effort, simultaneous movement during the forced inspiration. And just towards the end, you see that left diaphragm was a little bit precocious, jumped up ahead of the right hemidiaphragm, no longer simultaneous. This patient came in with shortness of breath. The only abnormality we see here is towards the end of the film where that right hemidiaphragm basically contracts sooner than the left hemidiaphragm. This patient came in, like I said, with shortness of breath, and we suspect that what is happening here is something called a penduloft ventilation, where the left hemidiaphragm elevating at a faster rate or sooner than the right hemidiaphragm, out of sync with the right hemidiaphragm. It causes air to move from the left thorax, the left lung, into the right lung because of the differences in compliance, differences in pressures. So this patient isn't able to exhale as we would normally exhale in healthy patients. There's a back and forth movement, left to right, with this patient causing dyspnea. This patient actually, so the diagnosis, so there's discoordinated hemidiaphragm movement. This patient, he's a 38-year-old gentleman and has a history of Charcot-Marie tooth. Physical exam findings in terms of neurologic findings are completely normal, except for dyspnea. In terms of respiratory failure or respiratory abnormalities in patients with Charcot-Marie tooth, is not something that is seen earlier on in the disease process. Usually the patients have progressed. They are showing some signs of neurologic dysfunction before you see worsening of their respiratory status. There have been case reports and few case reports in literature talking about sporadic respiratory failure in patients with Charcot-Marie tooth. And the dynamic X-ray allows us to see this in this patient who would have otherwise been deemed completely normal neurologic status, PFTs are otherwise fine, chest X-ray looks great. But we're able to see this discoordinated hemidiaphragm movement, this penduloft ventilation in this patient with Charcot-Marie tooth.